Hello, everyone. We still have several people ding-donging in. As a reminder, if we don't see your name as we know it with your organization, if you'll please change your screen name. We don't want anything that says iPhone. We want to be able to take a screenshot of everybody who's, the screen showing that everybody who's here. That's how we take roll. And so we need to know who you are. We're going to have another quick questionnaire for everyone like we did last time. In the chat, I have dropped in a link to a little questionnaire on REDCap. So if all of the home visiting folks would complete that, I would appreciate it. And I will be dropping that link in a few times. I'll drop it in again since some people just ding-donged in. If you're a home visiting person, please fill out this questionnaire. And we'll wait just a moment. David, are you here yet? I think we're waiting for David, so give it another minute, then we'll get started. We didn't update the agenda before it was sent out to you, so it looked pretty blank, but this is what we're doing. Right now, all the home visiting staff, you're completing this short questionnaire like we've done before. And then at the end of this meeting, we'll go over the answers. Dr. Bard will have some implementation updates, and we're going to hear from Michael Figgins at LASSO about the impact of the pandemic. And then, of course, at the end, I'll go over those answers to the questionnaire. Tabitha, I see that you're on by phone because I know you're coming back from Tulsa. I don't see David in the meeting yet. Is that correct?
No, he's not here. He's hopping out of another meeting. So.
Okay. Well, why don't we mix things up a little bit and let's go ahead and have Mr. Figgins present. Is he here?
He is.
All right. Hi, Michael.
Hi.
I will stop sharing so that you may. If you just introduce yourself to those who haven't met you before, I think you'd do a far better job than I would because it would be limited to he's an attorney with LASSO.
Hey, well, Lisa, this is sorry, I was going to say, hey, Lisa, we have a slide to introduce Michael Figgins, just so we can let the collaborative know why we've asked for his time and perspective and how it relates.
Okay, let me share that real quick. So, yeah, one of the aims of this project is to talk about the social support that's been affected by the pandemic, and we want to bring this improved care coordination. And I was right, he's an attorney, but more importantly, he's executive director of LASSO. Is that the slide you were talking about, Tabitha?
Yes, thank you.
Thank you. All right, Michael, take it away. And I'm going to drop that link for the survey for the home visitors to complete. I'm going to drop that in.
So much, Lisa. As Lisa stated, I am Michael Figgins, and I am the Executive Director of Legal Aid Serves Oklahoma. And I'm so glad to be on this call with all of Lasso's home visiting partners. And certainly there's a lot that Legal Aid could do for you all, make your jobs easier, give you better outcomes. And I'm looking forward to working closely with every one of you, if not individually, directly, then certainly through staff. So I was asked to talk about the pandemic's impact on legal aid. And like every organization, there was an impact. For me personally, it was my first global event. And I don't know if I ever want to experience another global event, but it was interesting in that sense that it wasn't just Oklahoma going through a pandemic, it was the entire world. The impacts happened fairly quick, especially here in Oklahoma City. It happened because a basketball game got canceled. And all of a sudden, everything changed literally overnight. And it didn't take long for people started losing their jobs. And when I say people losing their jobs, I'm talking about folks who didn't have the highest income jobs, the people who maybe waited on you at a restaurant, helped you at a grocery store. They started losing their jobs. They didn't know what to do. And they came to legal aid saying, we need unemployment insurance. Our unemployment insurance caseload quadrupled literally in a month. And fortunately, we were successful in many cases, and that income became the only income these families had. So that benefit, getting people some form of income, was the first certainly hint to us that this was a big deal. And of course, if you're having no income or less income, you don't have resources to pay for things. And of course, the big thing that people have to pay for is housing. So it wasn't too long, we saw an increase in evictions. Where landlords were saying, well, pandemic, I don't know what that is. You're not paying the rent. I'm going to evict you. We saw many benefit denials. I don't know. It just seemed like it was coincidental. People losing their SNAP, people losing their Social Security, people losing their health care through Medicaid. And again, legal aid was there to help getting all those benefits reinstated as much as we could. Then we saw an increase in family stability. You may say, what's that mean? I'm talking about people being violent toward each other. And it was all enhanced by the fact that during the pandemic, we had social isolation. Nobody was going out. So that means the survivor and the batterer are on the same roof for day after day. There was distancing. Don't get close to me. Don't go out and talk to anybody. And if I had a protection network as a survivor, if I could call somebody to help me, it's pretty tenuous. People weren't going out. People weren't helping. And so basically you had a confinement of a survivor and a batterer for month after month. And as you can imagine, it got bad. So we worked closely with the domestic violence shelters, making sure that people got protection, got out of that isolation, got help. But again, that was saw many, many more than we'd ever seen in the past. And all
Excuse
these,
me, Michael, do you have slides that you're sharing?
no, this is
Oh,
all,
okay. Okay. I just want to make
Yeah.
sure thank you.
Yeah, it's all context. So, but I'm open to questions at the end. So all these health and social inequities primarily had impact on the people we all serve, the poor. And again, the impacts, loss of job, income, loss of a house, sharing with a batterer, all these things happen simultaneously to many people. Sometimes many things would happen to the same person. So during this dark time, there were also opportunities. Lack of access to legal aid, people not going to legal aid, people not going to find legal aid, meant that legal aid had to go other places. And there were some places where legal aid was welcome. So we became more out in the community, more embedded at other places. If a nonprofit was serving individuals, we wanted to be there as well. And a lot of you probably say, well, how do you handle all these additional cases? Well, the people who were doing outreach and education before weren't doing that anymore. And then they were able to serve more people directly. I mentioned we did a lot more unemployment than we ever did before, which was certainly significant to the community. Housing instability, doing so much more with eviction prevention than we ever did before. And I'll talk a little bit more about that in a minute. And with healthcare, with the marketplace, healthy kids, Medicaid, we had so many people that we kept healthy, at least with access to healthcare, that we couldn't have done before. And of course, I mentioned all the work we did with family stability. So all these injustices, all these unfairness, all happening at the same time, illegal activities, everything unleashed on the low-income community. And it was tough. And I'm glad legal aid was there, and I'm glad legal aid was able to take advantage of opportunities to expand and do more. So let's talk about evictions just for a minute. When it all started, it was bad, people losing their housing. Then came a moratorium where couldn't do any evictions. Court was actually closed for a little bit. That was nice. That didn't last long. Then came rent assistance for about a good year or so, where if you didn't have the rent, you could get it. But it's funny, the way it was supposed to work is I would go to the rent assistance people and they would say, "Oh, Michael, how much do you owe?" "Oh, $1,000. Okay, fill out this paperwork and we'll make sure your landlord gets paid." But more and more landlords said, "Oh, we don't want these people paying us the money," because they were thinking, "Oh, I'm taking federal dollars. I'm going to get audited. They're going to be able to track me. They're all kinds of stuff that they didn't." So we had to give the money to the client, who then actually gave the money to the landlord, and sometimes that didn't work out, but it was crazy. Now what we have, the legacy of all that, is called right to counsel. Right to counsel, exactly what it is. It's a right to an attorney if you're facing eviction. Ideally, legal aid sees people early. The earlier, the better. We can get things worked out before they actually go to the courthouse. And we have 2 zip codes in Tulsa County and now 3 zip codes in Oklahoma County. And we're hoping to be able to expand it throughout those counties in the near future, so that if you're facing eviction, you have a right to an attorney. In the healthcare, certainly legal aid is the health navigator throughout the whole state, Healthy Kids Grant as well. And from the pandemic to now, legal aid tripled the number of medical legal partnerships that it has. And I'll talk more about that. That's basically an attorney, a legal aid attorney embedded, just like in your situation, in a healthcare situation, providing legal services to address social determinants of health. And I mentioned DV shelters. Legal aid now has an attorney embedded pretty much every domestic violence shelter everywhere in the state. So every time legal aid sees somebody, we look at their income. Is there any way we can enhance that? Can we increase it? Can you get Social Security? Be surprised how many people apply for Social Security. They're always denied. First time you go in, you walk in the office with your head in your hand, they'll say, you can work. So, but legal aid does the appeal. Legal aid gets the income. I mentioned unemployment before. You'd be surprised how many people work and don't get paid, work overtime and don't get paid. People who apply for SNAP and they're illegally denied. LEHAP, earned income tax credit, is a benefit most people don't take advantage of. Child support goes unpaid, and more. And on the flip side of that, we look at debts. You'd be surprised how many people are paying debts they don't owe. I mean, landlords charge fines and fees that are illegal. Criminal defense, not criminal defense, criminal, when you get out of prison, there's all kinds of fines and fees. And again, those can be waived and made to go away. You just need to come into legal aid. We'll see what the debts are. At worst, we'll do debt negotiation and can save thousands of dollars on debt, thousands of dollars on income increase. Put that together, you can actually pull people out of poverty. So we're looking at new partners as a result of the pandemic. We have probably 50 more partners than we had before. And I'd like to think there are another 50 to 100 more partners we need to find, because partners make legal aid's job a lot easier. And I'd like to think legal aid helps partners help their clients. So I mentioned medical legal partnerships. In a nutshell, it's a flexible, evidence-based public health intervention designed to meet the needs of the community. That's what a medical legal partnership is. It hasn't been around a long time, at least not in Oklahoma, but it's a growing opportunity for both of us, because a medical legal partnership can and will address complex social determinants of health issues, things that are going on outside of a doctor-patient relationship that will impact the ability of that doctor, that healthcare provider, to make that person well. A medical legal partnership can and will facilitate access to essential legal services, stop evictions, stop domestic violence, make sure a child is not growing up with mold, all kinds of toxic worry and stress that legal aid can make go away to allow people to focus on being healthy. A medical legal partnership can and will prevent and alleviate health disparities. And those are prevalent throughout the low-income community. And finally, can drive system change. There's been situations where a doctor would say, well, what are we going to do about these apartments, or the fact that there's no code enforcement? And we can actually do systemic legislation systemic advocacy to make wholesale changes. So how's it work? As I mentioned, there's an attorney, a Lasso attorney, actually embedded at the healthcare provider, part of the healthcare team. I like to think they're embedded to the point where they're like a specialist, like an oncologist or a cardiologist, and they're asked for their opinion when the need comes up. So Lasso teams, train the healthcare staff on the legal issues and stuff we're looking for, tell them what they should be looking for, triggers, signs, and help them identify those to legal aid. And we're looking for health harming legal needs, something that's harming somebody's health that really is a legal problem and requires a lawyer to resolve. And as a result of that, Lasso addresses those needs, make those problems go away. So framing legal care really as healthcare will get you 4 outcomes. 4 outcomes if you frame legal care as healthcare. 1, you'll have an integrated legal case, healthier patients. You'll have legal services there on site. You'll have integrated legal care, more efficient, effective healthcare team. You might think, well, why can't we just tell the patient to go to legal aid? Those referrals don't work. People don't come to legal aid. They don't have transportation. They're intimidated, and it just doesn't happen. It's much easier for a healthcare provider to say, I think you have a legal problem. Legal aid's 2 doors down the hall. Go talk to them. Number 3, integrated legal care. Healthier solutions for the entire community. And finally, integrated legal care means healthcare cost savings. You will get quicker results, you'll get better results, and you will save on costs that are currently being spent kind of spinning your wheels because there's an illegal issue out there that's making it much, much harder to make that person well. Any questions for me?
This is your chance, everybody. Jump on in here and ask questions.
Maybe I just exhausted the entire topic. I don't know.
Mr. Figgins, you do such a good job at explaining things too. That's something I've noticed, that it's always so clear.
Thank
that
you.
Sometimes I get to the end and I think, well, I don't have any questions. So,
Well, I have one question. Please follow up. Everything I've said is accurate. It's something we aspire to do, things we're actually doing, and we can do it for every one of you. If you have home visiting clients, I assure you, every one of them has a legal issue. If you're not sure what that legal issue is, contact legal aid, contact me directly and say, I would like more training. Tell me again what those legal issues are, because I want to provide the best care I can for those I serve.
that's a great offer. Thank you so much. Pilar, it's good to see you here too. Jade, did you have a question?
Well, I was just going to give some positive feedback because I saw Pilar pop up too. And we've had some wonderful success with Lasso services with our team. And it really has been a game changer, talking about that toxic stress and, just alleviating, just that worry and things that come with those issues. So we had some really successful cases on our end. So we appreciate you guys.
Thank you. I couldn't have said it better.
That's fantastic. Thank you. We appreciate that. Okay, if there's no other questions, if you think of one later, you can always email Michael. If you would like to drop your email address into the chat, Michael, that would be terrific.
Sure. Or
Thank
you can
you
just
so much.
ask Pilar and she'll convey whatever questions that you may have.
That's true. She's been fantastic about making herself available. She's been a real game changer in terms of she's to get a lot of credit for the successes we have seen. And
Lisa, thank you for this opportunity. If the need ever rises again, I will be ready.
Oh, we sure appreciate it. Thank you.
You're welcome. Bye-bye.
Bye. All right, I'm going to show the screen again, and I'm going to turn it over to Dr. Bard.
Thanks, Lisa. I don't have a whole lot to update the group on for the project as a whole, at least not anything that you don't already know. I did, however, want to tag team, I think, this topic with Lisa about objective number 1, because we have had some questions arise in the last month from some of our referral network partners specifically about what to do if they want to refer their clients, their families, to home visiting. I think we've had the most direct access and information exchange with the Sooner Start programs, but what I'm about to say applies to LASSO and it applies to PCAP as well. I was going to flash on the screen the objective, but it's easy enough to just.
We have it as a slide. Lisa, if you go forward, there's a slide that has objective 1.
Oh, perfect.
Is that it?
That is it. Yes, thank you.
Okay.
So you can see here, we're hoping to increase the number of referrals to home visiting services by 25% annually from our community agency partners. And to track that, we're trying to use the same net that we are capturing referrals going in the other direction. So in Unite Us, if we're using the, and you'll have to help me with the terminology here, but if we're using the MIECHV sponsored referral pathways here, the referral network IDs on Unite Us. Rescue me here, Lisa, at some point.
The innovation grant organizations.
Thank you. Innovation grant organizations. That's the terms I'm looking for. Thank you. If you use that pathway, then we'll be able to track it. They'll send us that data and we'll be able to see how many of your families are being referred back to home visiting as well. We do have a safety valve here, home visiting folks who are on the call. We would like you to still use your ETO documentation. I think many of you have to do that anyway. So we're checking in ETO as well to see where did that referral come from. And just in case we miss it through Unite Us, that's our backup. But ideally, all of these will show up in the data that Unite Us provides us as long as it's attached to an innovation organization. We looked at the last learning session, how many referrals has home visiting been receiving historically from these network partners, and the bar was pretty low. Now, maybe some of that, if not all of it, is just documentation issues where we haven't been documenting those referral sources with the same level of clarity that we're now able to do in Unite Us. Be that as it may, that's the benchmark here, is trying to surpass what we've done historically. And historically, those numbers have been extraordinarily low. So the 25% may sound daunting, but with just a few of these referrals over a period of a couple of months, we'll far surpass that benchmark. I think that's all I want to say, and then I hate to put her on the spot. Well, actually, two individuals on the spot, but I know LaShonda Stevens-Toteme and Elizabeth Fankhauser have been having this conversation specifically in the context of Sooner Start referrals. But real quick, LaShonda or Elizabeth, anything you'd like to add, and maybe lessons you've learned in your conversations with Sooner Start?
Well, we're going to have a follow-up meeting, and just that meeting with their team, just, going over things we were able to see, to share the benefits and the goal of this project. So, and just establishing closer, more intimate relationships, which, is always a good thing. So we're going to be meeting again in a few weeks and looking at how the referrals come across. And so we'll have more details after that meeting, but we're just excited to they're welcoming us into their space and getting to meet more of the team. So we're looking forward to that, and just keep sending those referrals through.
We being the university team, we currently do not have access to row level data in Unite Us. I think we mentioned it on the last monthly call. We've been working on a new data use agreement with the company so that we can share that information. We do, however, once a week meet with Unite Us, and they give us the aggregate counts of records that are flowing back and forth. And if any problems have been encountered, they share that information with us. So we have a pretty good idea of how much data we're going to get with our first data exchange. And I'm pleased to report that the data use agreement is now finalized. We are simply waiting on a secure pathway between Unite Us and the university to be shored up for that first data deliverable. So pure, per usual bureaucratic processes here. We're going to make this as complicated as we possibly can. We've got to get our IT department involved here on the OU side, and they're going to want to probably do a risk assessment, it sounds like, before we can finalize that data exchange. But we're near the end of it. And I bring that up because the dashboards you're all accustomed to seeing, home visitors, home visiting agencies are accustomed to seeing. We've been building pipelines on the back end of ETO. We're ready to connect it to this Unite Us data when it arrives, and then ship those to you. Our plan is to ship those weekly like we have done in the past, and we're just waiting on that data to arrive. Lisa, I think that's it for my segment, unless I'm overlooking something we've discussed previously.
Okay. Tabitha has been texting me. She's since she's out of town, it's inconsistent on when she's able to chime in. Tabitha, are you able to speak right now?
Yeah, is my sound quality okay?
Yes, it's fine. I'm on the slide that talks about liaisons receiving additional training October 9th.
Yeah, so we just wanted to let you all know, as the last monthly call, we identified some confusion on when the custom forms were accessible. We had originally had it incorrectly where you could only get to it once the referral was accepted or rejected. Now we have it where once you hold a referral in review, meaning you're processing it to see if it's one that's eligible, you can add the custom form as intended. So the liaisons were trained on that by Kayla on October 9th. Again, you should be able to access them now. If you need support on that, please ask a liaison or reach out to Kayla for further training. But a reminder that we ask you to update that form as you work the referral up to the point of acceptance or rejection. So once you've received it and you're working it, please update that custom form. So if you received that referral, it is your job to upload that custom form, attach it, and update it. So if you made the referral, if you're not seeing a custom form attached to the client or being updated, please or liaisons or
now you're breaking up a little bit.
Team so we can assist.
Now you're breaking up just
Okay.
a little bit there. Yeah, if you can't see the custom form being updated, just let us know or let the liaison know, and we'll follow up on that. It's there's a button for new form submission for these partners who will be updating the form with contact attempts and so forth. And at first, when I saw that term new form submission, I thought this is submitting a new form, but that's not what it is. It's a new submission on a form. So to update that custom form, you can start it with and then update it with that new form submission. So we'd like to see, how many times it takes for you to be able to finally reach the family, schedule an appointment, or determine eligibility and so forth. So please let us know for those of you with, mainly those of you with, well, it's actually true for everybody because there's a form for the home visitors too. So if you receive a referral, say from Sooner Start for somebody who will become one of your clients, then you can go in and there'll be a form for you to fill out information about the referrals you receive. Tabitha, is there anything else you'd like to add about that?
I would just add, to be sure, if you are making a referral and Unite Us and you're a home visiting provider, that you need to be adding the ETO form. So that happens in the very same place. It's now accessible. So please remember, add the ETO form and add that client's ETO number so we're able to match it.
Yes, and I think we passed around the word during the rounding calls too. But in case you didn't hear it, when you're making a Sooner Start referral, you'll need to be sure to include a note saying the parent's name, because you put the referral in as the child being the client. But when you put in the contact information and you put in the phone number, you'll also need to put in a note saying, guardian grandmother's name is Letitia James or something. So anything else on that, Tabitha? I hope that was nothing, because I didn't understand what you said. All right, I see a slide about the innovation strategy. Did you want to talk about, is this part of what you were going to talk about, David?
Next thing is to highlight that we're looking at referrals across the board, so not just from home visiting, but home visiting.
Okay, David, could you chime in and repeat what she just said?
Yeah, I'll try to translate that. I think this was my lead in to the topic I mentioned before, and just showing the diagram that those are meant to be two-headed arrows. So we're interested in referrals going both directions, to home visiting as well as from home visiting to the referral network partners.
Okay, and I see a Parent Pro black box. I don't.
It's
Yeah, I can take this one too. So this is guidance we provided to the Sooner Start program. We've been asking them to lean on the resources that are available at the parentpro.org site. Of course, all the home visiting agencies on the call today know that site well, but for our PCAP and our LASSO peers and our Sooner Start peers, if they're on, parentpro.org is the umbrella term that's used to promote the home visiting operations managed by the health department. And on that website, we have information about specific home visiting programs. I'm sure you know by now, we've got the three separate models: the parents as teachers model, the children first model, and the safe care model. So a description of each one of those home visiting models, and then the individual agencies that deliver those services are provided on that website. There are handouts that you can provide to your families if they're interested in home visiting, that give them the central intake number. You see that listed there at the end. This is also part of the guidance we have passed along to our Sooner Start colleagues. Those individuals on the call line will help identify a program that seems to be a good fit for specific families. Each one of those programs have a slightly unique eligibility criteria. They may also have variable numbers of spots that are available, and obviously location matters here too. So the central intake line can help sort all that out for any potential family interested in home visiting. We encourage referral network partners to utilize that phone number and the website when having this conversation with your families. All that said, I don't know, this might be another slide coming, but all that said, we do want you to use Unitas when you log that referral. So even if you call the intake line and they're going to relay that information back to the agency so that we can track it for the purposes of the project, we'd still like you to submit that referral in Unitas. The benefit to doing that is not only that we can track the data, but you'll also be able to facilitate that bi-directional communication. And the home visiting providers, when they receive your referral through Unitas, can then alert you as those clients pass various mile markers in their service delivery journey with those agencies. I believe we can, if we haven't already, circulate the online version of this flyer that you see now on the screen to all the referral network partners.
Yeah, we'll be sure to do that after the meeting, and we'll also get these slides out to everybody in our follow-up email.
And we're happy to coordinate the delivery of some of these flyers too. printed copies of those, if that would be helpful.
Absolutely. Any questions at this point? Well,
We'll be going over this when we meet next time, and Soon Start was really excited when we were talking to the coordinators that handle referrals. So they were very excited about Parent Pro and very interested in seeing how to use Unite Us to do that and be able to get updates and everything. So we're looking forward.
great.
We're going to go all look through their current process and then with this, but yeah, never can always tell more people about Parent Pro.
Yeah,
Can we
go ahead.
can we make a referral to Parent Pro outside of Unitas? I mean, outside of Innovations?
Yes. Or you mean out, so or just anybody in general that's not part of innovation? Is that what you're?
Correct. So I understood that only our innovation attorneys could make referrals and unite us to the innovations grant. So could I make this resource available to all the attorneys in legal aid to where they're making them outside of the innovation grant itself into the home visiting?
Yeah, this is available to anybody in Oklahoma, isn't it?
Yes.
Absolutely. Yeah.
Yes.
We'd like everybody to make those referrals. If it's a referral to one of our innovation home visiting agencies, so one of the agencies participating in today's call, we'd like it logged in the Innovation Unite Us pathway, if that is possible, Pilar. But if we're talking about a family that's being served, let's say in Southwest Oklahoma or Southeast Oklahoma, and they're being referred to an agency down there, then calling that central line and relying on the traditional referral connection would be the encouraged pathway, would be the encouraged next step. Yeah.
Thanks.
Other questions, other
Yeah.
comments?
It's the hidden jewel. So, and Pilar, if you something comes up later, you have a question about it, you can always reach out to me. But yeah, every so often I just post this on my Facebook and social media just for people to know about it. And they also have their own they have it on their own social media as well. So they post things over there. So it's an excellent resource for anybody that's a parent, becoming a parent, anything. And there's a lot of other resources over there on that website. So I tell all my friends, family, everybody about it. So you can just
Yeah, and even if
share
somebody's not a brand new parent, they may confront a situation that's new to the family and then could use the reminder about Parent Pro.
I want to link that to the Right to Counsel program that Michael talked about.
That'd be great. And I feel it's a bit remiss to not call on our home visiting colleagues here. Any other advice for Pilar or PCAP or Senior Start when making referrals to your programs? Susan put something in the chat.
Yeah, this is Susan. I would just say that sometimes it gets kind of confusing because we have different enrollment criteria. But what's really nice about Parent Pro is that Ronisha, who answers the phone and kind of manages, well, she manages the website. She's very knowledgeable about resources in different parts of the state and about, so I'm the nurse consultant for Children First. And we have a different enrollment protocol than Safe Parents as Teachers or Safe Care. And Ronisha can help families negotiate through all of that. But it's also on the website. If they don't want to talk to someone right away, they can also choose their geographic location in the state and see what's available. And there's descriptions as well.
Thanks, Susan. I see why you use the chat. You sound like I do.
Listen, this is actually better than what I was on Friday. I sounded like Minnie Mouse.
I know so many people who are having upper respiratory problems, at least partly because of allergies. Thank you for sharing that, Susan. That's very helpful.
Yes, thank you.
Other comments, other questions? Okay. This came up during our rounding calls. How do you see all the referrals made by your agency? If you're an org admin or an oversight user, then you can see all the referrals, but there are some default selections that can keep you from seeing everybody's referrals. It's going to default only showing yours. And so to see everybody's, if you're one of these roles, the org admin or oversight user, then on the home page, you'll go to the outbound referrals and you'll click all, and then there's some drop down menus. And the first drop down menu is care coordinator. And to get rid of the defaults, you have to click select all and then clear all. And then you have to check the more filters drop down to make sure nothing is selected. And so that's, if you're in one of these roles, you should be able to see all your agency's referrals, outgoing referrals that way. If you're not in one of these roles, then you'll only be able to see the referrals that you yourself made. So you'll get these instructions when we distribute the slides. We already talked about that. All right, David, is there anything you want to cover before we go into the answers to today's REDCap survey?
No, let's move on.
Okay. All right. So the first question, true or false? While Lasso provides free legal advice, full legal representation may result in a retainer fee. That is.
Sorry, I did the wrong one. That's definitely false.
That's false. Yeah.
Yes.
This is no.
Wrong formatting. 100% false.
Let's choose a nice happy color. Let's make it green. This one's go away. We'll make it very small. Go away now. Not true. It's false. So this is the true part of the sentence. Lasso provides free legal advice. Your clients are not going to get a retainer fee. All right, check all that apply. In the United system, home visiting agencies can receive feedback about the status of the referral in several places. Those places include, and there's all these options here. Here are the correct answers. The client face sheet may be updated. The page for the specific referral, if you navigate to that referral, and you also may be exchanging email within Unitas with the referral partner. So it's not going to be in the My Network tab because that's going to tell you about other organizations that are in Unitas. It's not going to be in the client supplemental information because that's not about the referral, that's about the client. And it's not going to be in the referral partner's organization profile because that's going to be about the organization. True or false, if a mother is randomized to not receive PCAP, she will be provided with a list of other community resources that address substance use. And that is true. If they're eligible for PCAP, but remember, it's a randomized controlled trial. So they are randomly assigned to either receiving the full PCAP services or to be basically in a non-treatment comparison group. And if they're in that comparison group, then they're going to be given a list of other resources and some support to get engaged with other options.
Hey, Lisa, while we're on that topic, I see Katie's on today. Hey,
Yes.
Katie, do you mind updating the group on when the enrollment for the randomized trial ends?
So we currently do not have a projected end date. We originally had planned to stop taking referrals by the end of this calendar year, but we have not enrolled the required number of people for the study yet. So I don't know for sure when we'll stop with enrollment. It may be another 6 months or more, just based on the rate at which we've been enrolling people currently.
And you anticipate continuing to take referrals after the study ends, correct?
I hope so.
Oh,
That is the goal, yes.
okay. Thank you.
Thank you, Katie. All right, true or false, parents or guardians can say no to their child being referred to Sooner Start, even if DHS is the entity making the referral. That's true. Parents are always free to make the decision about the services their child receives. Check all that apply. LASSO may be able to help home visiting clients with the following kinds of cases. So we're looking for a check mark if LASSO can help with those cases. And here are the ones that they can. They can help with wills, divorce, adoption, tax audits, bankruptcy, identity theft, disability benefits, and disaster relief resources. The ones they cannot help with are child product liability, applications for retrial, or class action suits against a housing developer. Pilar, is there anything you'd like to add to that? Okay.
I'll just add, and I think it's obvious by now after Michael had spoken earlier, but this is not an exhaustive list, right? So
right. Yeah, this was just some that we thought of, that we thought, well, let's see what everybody knows about, and maybe, and as I said, with the first time we did one of these quizzes, the reason for doing this is not to say, aha, you put product liability and you shouldn't have. That's not our goal. It's to help us all learn more about what these resources are and what kinds of help can be provided. All right, mothers who receive PCAP work with a case manager for 1 year to help them through substance use treatment and recovery. A little bit of a tricky question because it's 3 years of support with a case manager. True or false? Some children qualify for Sooner Start because they've been diagnosed with a physical condition that has a high probability of developmental delay. I think everybody got this right, that that's true. If they had some condition or physical condition that they were documented to have that has an association with developmental delay, that's enough to get them qualified for Sooner Start services. So they may have been born with some condition that you can refer them directly. And I think y'all are real familiar with that. The home visitors are. Home visiting agencies are responsible for adding the ETO form for clients in Unitas by completing the ETO form when they send a referral. This is true. I think everybody got this one right too. The agency that receives the referral will update the custom form with the mile markers for that receiving agency. So like if you refer to LASSO has a custom form that they will need to update with, attempt to contact the client, scheduled appointments, and so forth. But when you as a home visiting provider are sending a referral, you're responsible for putting in the ETO custom form. And it's just one item. It's saying ETO case number. And we need that on every referral, or we're not going to be able to match it to your ETO data. And that is it on the quiz. And that's everything that I had on the agenda. How about you, David?
I think that covers it.
Does anybody have anything they'd like to bring up? Any concerns, any questions, any Halloween costume ideas that you'd like to share? I saw oh, thank you, Susan. I saw a little video on TikTok of a guy dressed up like Indiana Jones, and somebody else had this big kind of like paper mache, gray, round costumes, so they looked like a boulder and they were chasing after him. That's one of the best I've seen this year. All right. Well, if there's nothing else, thank you everybody for your time, and we will be seeing you soon on some rounding calls next month. Happy Halloween.
Thank you. Bye.